Greetings, everyone. It is Deidre. This is Information with Deidre. Welcome, welcome, welcome. It's Thursday, so it is our Public Health Career Spotlight. And I have a new, wonderful, dynamic guest today, Dr. Kadesha Nichols. I've mastered which direction to point.
You did it.
So go ahead and introduce yourself to the people before we get into it.
Yes, first and foremost, thank you, Deidre, for having me on your platform. I am extremely excited to be talking a little bit about public health, what it is I do. And I'm just excited to have connected with you first and foremost. We'll get into the backstory a little later, but I'm really excited. I'm proud of everything that you've got going on. But a little bit about me. So as Deidre mentioned, I am a doctor of public health. I recently completed my degree December of last year. I work for a healthcare system. I'm a director of operations there. And, I also have a company called Let's Talk Health Inc., which primarily focuses on educating, empowering, and just getting the word out there about all things Black health. And so I have a Facebook page and a website that I just spew out lots of health information. And it's really geared towards helping people to make informed health decisions. So yeah, that's a little bit about me.
Thank you so much. And I will be sure to put the links for Let's Talk Health Inc. and your LinkedIn, if that's okay. And put those in the description box. So if you have any further questions for Dr. Nichols, you can reach out to her directly.
Yes, please do.
Yes, and as always, the chat is the space for questions. So we have our own questions, but sometimes our viewers, and we have regulars. I do have regulars. And they ask questions. So greetings, Sovereign Eves. Glad you can make it. And as people kind of like pour in, we'll greet them as well. So the first question is which is always answered in the beginning, which is like, what do you do? What are your profession? So, I think it's awesome that we have melanin rich people in this world doing the work that you do, saying like, I'm going to go and I'm going to go to school and I'm going to use this degree and I'm going to help my people. I always think that it's commendable. So kudos to you.
Thank you.
And thank you for taking time out to be on my little show. Hopefully it'll be my big show.
It's going to be a big show. Put it out there, girl. It's going to be a big show.
And we're going to rename it the Big Show.
Yes, from your mouth to God's ear. Let's do it.
Big show. So, can you, I'm going to like kind of go a little bit deeper into one of the questions, which is like, what public health field does your job cover? And as you're describing that, if you can give the folks, because this is about like people who are new MPH students or new grads and people trying to figure out what they want to do. So also, if you can explain the doctor of public health, because we were chatting before and I was like, when I was in school, I was like, what's that? I didn't know. I thought it's just MPH. I thought DRPH. I was like, what?
Yeah. So it's probably a relatively new field. I'll start with a little bit of background about the DRPH. It's been out for a while, but public health has just grown into like this big, wonderful world that everyone wants to be a part of after COVID. We started to hear more about public health leaders, what they did or what they were doing. And it's I guess a little bit before then, it kind of made its mark in the world. We wanted to understand what was happening in the world. What diseases did we need to look out for? How do we prepare ourselves for these diseases? It's all about prevention and preparedness. Like what are we doing to make sure that none of this impacts us? And if it is, what systems do we need to put in place to change or fix it or help those that are impacted by it? Mm-hmm. So that's a little bit about public health. And specifically for me, I focus on Black health. So public health can encompass a wide array of things. You can look at it at a global level. You can look at it at a community level. It really all depends on what you decide to do with your degree. Yeah. I started off as a master in healthcare administration, and I took a public health course during that process, and it was all about maternal health. And I kind of dug myself into this hole of looking for information as it pertains to maternal health. So, and the hole just kept getting deeper and deeper. And I'm like getting angrier and angrier because I'm like, Black women are what? We got what? We are 10 times, we are 4 times, we are this. This is insane. What are we doing about it? And at that point, I was just like, yeah, I need to, if I feel so strongly about this, I
Mm-hmm.
definitely need to be a part of the movement and be a solution driven person and do what I can to change the narrative. And
Mm-hmm.
so I decided to jump into public health. And that's pretty much all I focused on throughout the time in school. Um, and it takes a toll on you because you kind of realize how much work there is needed to be done in the world, and it's like you want to fix it all but you can't, and you're trying to do your best but you can't. So that's kind of like how I got into public health. My job is not a public health job. It is a strictly administrative, let's talk money job.
Mm-hmm.
I pretty much oversee a few hospital systems in South Florida, and look at the finances of the doctor. I look at, strategic growth and opportunities, and I do a lot of that, managing different practices. There, the organization itself does not have like a community outreach program or community outreach space. So my job is really just, analyzing what's happening with the providers, analyzing what's happening within the clinics. What can we do? What do we need to address? And kind of just be a step ahead of the curve. Now, that's one of the amazing things about public health is that you can be solely administrative, and not do anything public healthy,
And
or you can definitely just jump into the what I call the help space. Public health is all about helping. So you
Mhm.
can definitely work for a nonprofit. You can work for the government. You
Yep.
can be a contractor. You can be contracted by the government, or work for like one of the companies like Deloitte, or like, and just do project management or things like that. So
Mhm.
you can pretty much be in any space with this degree. And that's the amazingness of it. You can pretty much be anywhere and do anything. But unfortunately, since I didn't have what I wanted to do in my career, I started Let's Talk Health because I still wanted to make an impact. Yes, I love what I do. I love interacting with patients. I love the connections I make with my providers,
Mhm.
but I still want to do more. I still want to have an impact in the community. So I just took matters into my own hands and created a space for me to do that.
Yeah. And sometimes that's what we have to do. Have
Yeah.
that entrepreneurial spirit.
Yeah. Yeah. Yeah.
I also have a 9 to 5, but it doesn't mean that I'm not moving in other ways to like make sure that I carve out a niche for myself. It's taking a little
Right.
longer than I thought, but it's definitely happened. Train
It,
is still
it's a lot.
slow.
It's a lot.
A little slow. But
and
it's what it
and we
is.
were talking about that. We were like, yo, we're just taking it day by day, just winging it as we go. Like, we
Mhm.
don't have all of the answers, but we're just making it work right
Yeah.
now. And that's why I was just grateful to have the opportunity to connect with you, because it's like, here I am trying to figure it out. Here you are trying to figure it out. We're kind of doing the same thing. So it's great to kind of have like a little community,
Mhm.
a little network of people that are just in the same groove and in the same space as you. So,
Mhm.
like you have someone to kind of lean on as you're navigating your way through this
Yeah.
whole process.
And I think also it helps to see where gaps are, right?
Yeah.
If you're covering a certain thing, it's like, okay, she's got this covered. Let me see if I can move over here. And then
Yeah.
we have, again, we were talking about holism, right? That
Yep.
holism. And so everything, is covered in like different pieces, and then we're connected. So it's like, all right, head on over to here so you can get here, hear more information about XYZ. Go to this place over here, so you can hear something about like, QRX, it's that
Right, right, right.
right order. I don't think X comes after R, but it's okay. You know what I mean.
We know.
You know what I mean. The next question, which is interesting because like there are different places, and you kind of touched on this a little bit in your answer. There are different, like the physical location where we are, like when you talked about it, like being very administrative. There is a part of public health that's very administrative.
Of course.
I know that, it's
Of
like
course.
it can be very ivory towerish, but depending on what your interests are and what you want to do, that probably is like a good niche for you.
Right.
Because you're still helping. Like just we have doctors and nurses and people who, frontline workers. Frontline workers can look different. Frontline workers also can be in the office because without that admin piece, sometimes the other things may not happen because you need the operations, right?
Right.
Operations,
Right.
the director of operations.
Right.
You need all of that to run. And so like as we've said before, like in previous lives regarding public health spotlights and careers, there are some people who are so specialized in what they do, they'll move up and up the ladder. So you'll have positions like director of operations. You'll have people who are in the C-suite because they've honed their skills to a level of where they can oversee a lot of different moving pieces.
Right.
So it's helpful for people to see like the highest heights of like where you could go, and even like what happens when you first start out,
Right. Right.
So what are some of the locations like that you have? I mean, clearly it's like the office, but it does not necessarily always have to be a hospital, or it could be an office. But I know like where I am, even as public health, my office building is in Tribeca. So it just depends. So like Tribeca's in New York for anybody who's never been.
If they don't know.
I don't think that they're weird, but in case.
Just in case.
What job sites have you been in your profession? Like even not just now, but like throughout your career in like public health, throughout your journey?
So I've primarily been in the hospital medical center space. I've worked for a teaching hospital. I've worked for a nonprofit hospital, and now I'm currently at a for-profit hospital. And within each of those spaces, of course, the vision, the goals, and the missions are completely different. Of course, with the for-profit, that's why I'm always looking at numbers. The company needs to make sure that they're making their money back. We're paying these doctors a certain salary. We need to make sure that we're getting our money in return. So that's why the focus is slightly different. But in a teaching hospital, it wasn't so money because we're getting grants, we're getting funding and things like that. So we can offer charity services. We can spend a little bit more time going into the communities, setting up a booth at different fairs. We can have networking events where we're going to other corporate offices and saying, hey, this is our health system. We're in the neighborhood. We'd love for you to, maybe have all of your employees do their annual physicals with us. So it really varies. And there are some health systems that have like community health departments. You can be in the C-suite of that department where you still have a direct impact on the community. It really all depends. And I think it really all depends on the hospital that you work for, that you can see something different anywhere you go. If you go to like a city hospital, there may be some more government funding, which means there might be more opportunities for community outreach. So it really all depends. And let's say you don't want to be in the hospital. There are so many nonprofit organizations that you can also work for that yeah.
That's me.
Right. So many nonprofit organizations that you can work for that still have, the room for growth and development. There are still like C-suites within those organizations. There are still, like you're moving on up in the ladder as well. So like there's opportunity for growth no matter where you are. I think the doctorate part just means that you have mastered it all. Like you've done it all. Like you've gotten so much education that anyone can ask you a question about anything and you'll know. And if you don't know the specifics, you'll know enough to kind of lead the pack and still provide enough information. And that's probably what I love about having a doctorate of public health. Because someone will say something, I'll say, oh yeah, Black people are 10 times or 2.5 times more, according to this study, like it just spews like right out of your brain. And that's what I love about it. Would I recommend it? That's another story.
It's okay. That's what we do.
Would I recommend anyone getting a PhD? No. I would not say, don't be like me, unless you want to be like me, unless you want to be one of those people that says, I'm just going to get the highest degree, because I did it without any rhyme or reason. I just said I wanted the degree. I'm going to do it. But unless it's required for your job, I would not. I if I could do it all over again, I would stop at the master's. But I'm here, so it's, yeah, use your discretion.
Right, discretion, discernment. I remember thinking, like, when I was at that stage, and I was like, do I want to keep going? Do I want a PhD? And I was like, because that was what it would have been from, I don't
Right.
think when I was in school, I think I'm probably much older than you.
Yeah.
And, like, there wasn't DRPH. It was like MPH and like maybe degrees and then like PhD. And it was just like, well, are you going to write? Are you going to teach?
Right.
So there's no need. And I was thinking like in the same, kind of wavelength. It's like, maybe I'll just get it, just to have it. Because, and part of it is also like being melanin rich, and you're like moving around in spaces, like you kind of move with this mindset. I have to have more,
right?
So that's what was in my mind and what was driving me at the time. And it was just like, you can do this, you can make this happen with just the MPH, because this is like a part, because I didn't even have a break in between. I went straight to undergrad.
Okay. No, I took some time off, and I had time to think about it. And I think it was because from a young age, I had always, put it in my mind that I was going to become a doctor. So my track initially was to become a pediatric neurosurgeon. I went to school, undergrad, pre-med, and I'm like, yeah, I'm going to do this. Senior year, I'm like, I am not becoming a doctor. This is crazy. And my mother was like, well, I don't know what you're going to do, but you need to figure something out, because you didn't waste all this money to get a degree to do nothing. So figure it out. And so I took like 2 years off, and I'm like, okay, time to go back to school. Got my master's in healthcare administration after speaking to a doctor, and he was like, why don't you just do admin? And I'm like, oh, okay, yeah, I'll do that. And then in the process, my mother's like, just keep going. Just keep going. You said you were going to be a doctor. Just become a doctor. And I'm like, all right, I got this. And then here I am, like, all smiles. And I'm like, yeah, I'm starting my doctoral program. It's amazing. I'm excited. And then you get to research. So they hold your hand the whole way. They're like, oh, we've got your back. This is what you're going to do. And then you get to the research part. And it's like,
lesson release.
Here's your mentor. Get you a preceptor. You've got to do this. You've got to do that. And it's like, okay, but you're not going to tell me how it's got to be done. Like, you're just, what? And I had to call a friend and say, hey, friend, is this happening in your program? And he's like, yeah. And I'm like, okay. Right. We just winging it. Why didn't you tell me? And through that entire process, I wanted to pull my hair out. I called my mom every day, and I'm just like, I'm not doing this. And she's a Caribbean mom. So she's like, if you want me to come through this phone and bust, I'm like, okay, no. Okay. We gotta
wasting the money. You lasted longer than I did, because they do that in undergrad, that weeding out, and I was like, that's actually really smart and really useful. So I got weeded out in freshman year, because I, like you, went to undergrad with like big dreams of being a doctor, an OBGYN. I was like, wait, by the time I actually have my own practice, I'm gonna be like old, like so
yeah.
I want to like get right to it. I wanted to jump right in.
Right.
And I found health administration. I was like, I like this.
Yeah.
This is cool. And then as I started getting later in my like college career, it was like public health. I was like, what's that? That sounds cool. And it was just like that was all she wrote. History.
Yeah.
And here we are.
Once you find it, I feel like you just fall in love with it, especially if you are an empath by nature. you have this desire to want to help people and want to do more, this is probably like the
Yeah.
best field for you, because there's so many opportunities for you to make an impact on the world. Like
Are
there's so many. And the good thing about the public health field now is that I think they understand that not everyone wants to do research, not everyone wants to write articles, and so
right.
they've created a professional PhD track, which you still have to write a paper. It's still a really long process, but it's not as extensive as writing a dissertation. They call it a capstone. And so you do your capstone and you're good to go. The process is fairly similar, but it's not as intense as doing the dissertation.
Right.
But I still wanted to pull my hair out in that process. I did get the professional PhD because I knew I wasn't doing research. That's not what I wanted to do. But
Right.
it's still a very difficult process. It's really not that easy. So if it's not something that you're passionate about, that you
Right.
can spend the next 5 to 7 years doing, I I wouldn't say do it. Like I
Yes.
wouldn't.
Yeah.
Yeah.
And one thing that we've always said, like one thing that's been consistent with the guests that have come on and talked with me is like, be passionate about it.
Yeah.
Everyone, for the most part, has been passionate about what they do.
Mm-hmm.
You have to like want to do it, because if you don't, you will, like, it's like any other job, you'll find yourself in this space, like, like a couple years later, like, why am I here? What am I doing?
Right.
Like, you really have to want to
Right.
kind of be in this space and help people, and like, have that be what you do.
Mm-hmm.
um and like you said, there's so much that people can do within this field. So
Yeah.
like, I myself like fell into it,
Yeah.
when like I just applied for, like, first I was more in health administration, like working in a hospital, a cancer
Mm-hmm.
center, and then I just fell into this position with tobacco,
Yeah.
and I realized it was advocacy, and I learned all about advocacy, and I was like, this is a thing, like public health.
Yeah.
I like it.
Yeah.
Because I really felt like I was like, I can touch things from like a larger level. Yes,
Exactly.
you need that, like, door to door community
Yep.
kind of experience as well. But like the advocacy piece is so amazing, because you teach people, it's kind of like paying it forward,
Of
right?
course. Of
So
course.
that was what the attraction was, for me. So like when you're thinking about your public health career, this is why we do this. So there's so many different things you can do. And I
Yeah.
really wish when I was in that position where it's like, well, what do I want to do? That there was something that said like, here's
Yeah.
all the things you can do, not just a list, but like, this is what it looks like,
Yeah.
you
So
know?
that's what I did initially, because like I said, I just got the degree because it was, to be honest with you, it was just really like, I want the highest degree I can get and I want to be called doctor. That's
That's
really all it was.
common,
That's
I think, among melanated people.
that's listen, like that was it. There was no, a lot of my friends, a lot of my colleagues were very strategic about what they wanted to do. They knew they were going to take step A, step B, step C. They had everything planned out. Here I am, willy-nilly, just like, I'm just gonna get this degree. Oh, what do you want to do with it? I don't know. I'll figure it out when I get there.
But
I'm just like, whatever. Like, we'll just. And I was, even until I was like done, even till now, what do you want to do with that? I don't know. I think recently I came to the point where it was just like, all right, I would like to be a chief impact officer. So I would like to stay in the hospital system and I would like to have that role as a chief impact officer. So now I got to get into the patient relations space and, so I can start making the connections at a community level and then making sure that the hospital has what it needs to meet the needs of the people in the community that it's serving. So, now I know what I want to do, but I was done with school in December. And it wasn't until this year that I was just like, I got it figured out. This is what I want to do. This is where I want to be. So
yeah.
I don't want people to feel like you have to know it all. You have to know what you want to do. You can just look up a list of things that are potentials. All right, a few of them look good to me. And
Mhm.
as long as you have a few options out of that list, I say go for it. Not everyone is going to be strategic. Not everyone is going to have their entire life figured out. We're human. We're allowed to move in that way. So it's okay. But you know, I would say look at that long list. If there are at least 4 or 5 different things that you see on that list that you would like to do, then go for it. If not, save your money.
Yeah, that has been a recurring theme. Save your money.
Save
Like,
your money.
it's like, yes, we all have a journey. And so it's like, go on your journey. At the same time, at some point, there does have to be some intention about it, right? So
Of
like,
course.
go on your journey. It's okay if you don't know right now, because like maybe your journey, some of your journey is figuring it out. And
Right.
once you get there, you'll know it. But if you
Right.
don't get there, then maybe like take some time to like reassess,
Yeah.
because you don't want to sit and again, like a couple of years and you spent all this money, and be like some of us who are just like, oh, thank Department of Education for postponing the loans because of the pandemic, right? Me too. And I'm just sitting, waiting for them to be like, oh, okay, we're just gonna forgive all the
We're just
loans.
gonna
But
write it all off.
that's
Thank you.
like, oh, happy day. That means I will have no debt. That's literally the only debt.
Basically.
The only debt.
Basically.
And it's just like so many people are burdened with the debt. So like maybe one day I'll also do a show on like the debt and like what some people did, how they maybe got out of it. So for those of you who are watching, if you know people, I'm always, open to taking guests. So if you have anyone that like, you can definitely hit me up in the DMs on Instagram. You can email me. All that information is in the description in the chat box.
Yay.
So you actually talked about like, your career path, which is great. So take us through a day in the life of. And you can do either like what it is like to be director of operations, or running Let's Talk Health Inc.
Uh, we could do a little bit of both. I think starting with the director of operations side of things, it's it, there really is no like set schedule. You really don't know what you're walking into from time to time. I think the one thing that we do know is every month we've got to sit down and talk about, the financials for each of the providers. We have to talk about what's happening at each of the offices. If I'm managing both inpatient and outpatient at the time, we need to understand what the dynamic is. I really come into the office, I'm onboarding providers, I'm offboarding providers, I'm hiring, I'm firing. There's pretty much a little bit of everything happening in the hospital. It's you really don't know. You can legit come in today and say, or hear some news and just be taken aback by it all. You just never know. But the one thing I think working in healthcare has taught me is I want to say patience, because you deal with a bunch of personalities, and we're talking about doctors, and so the personalities are just a little bit up here because and I work with surgeons specifically, so you've got a lot of personality, a lot of like diva persona. You've got to, and you, a lot of them don't want to hear no. And sometimes you're the bearer of bad news. So no is what you're going to bring. And so you have to be able to walk into this space, be able to conduct yourself like this, and deliver the news, and just wait for it. Just wait for it to come your way and say, okay, I hear you, and walk away. And if you're not able to do, and you get that all the time, that's one thing I can say you can expect every day is diva. You can expect diva every single day. And you just have to be able to like let it roll off your shoulders. Like, listen, I'm here to do my job. I'm delivering the news. This is what we're doing. It aligns with the mission and vision of the hospital. So this is what we're doing. And that's it. With Let's Talk Health, it has definitely been a learning experience for me, because this was something it started off as several different things before it came what it is today.
Right.
So I wanted it to be like a resource center where African American people could come, and maybe they could locate like all Black doctors, or maybe they could, get articles on specific things if they were looking something up, or maybe if they needed whatever it is, it was going to be like this hub of information for Black people to come and learn more about, health, or find doctors that looked like them, that's initially what it was going to be.
Mm-hmm.
And as I was building it, I learned that the people I'm trying to target, they're
Yeah.
not going to be the people that's going to think, huh, okay, let me look this information up. And so they're just not. And so you have to bring the information to them. And
Yeah.
I thought I would have more of an impact if I was that information hub in a different space. So
Mm-hmm.
I'm going to bring the conversations to them. I am going to reach out to people in their communities. I'm going to reach out to people that they know and have conversations with these people. I'm going to post on topics that hit them specifically.
Yep.
When you see a post on, oh yeah, get screened for prostate cancer, someone who's in a low income community, they're not going to think that applies to them. So when the content is, you know, low income people or Black males are this times more likely to be diagnosed with prostate cancer. Have you gotten screened? When the content looks like that, it's like, oh, I'm a Black man. I fall in this category. I
Yeah.
don't even know what a screening looks like for prostate cancer. Maybe this is something I should do. And
Right.
then when you spend an entire month drilling people on one particular topic, that's all they see, that's all they hear. It's like, all right, I'm tired of Kadesha, just talking about this stuff. Maybe I'll do something.
Right.
Um, and that's kind of how Let's Talk Health Today came about. So we spend an entire month talking about one particular topic,
Mm-hmm.
and we'll maybe touch on a little bit of things here and there, but we're focusing, like June, we're focusing on men's health. That's
Mm-hmm.
all you're going to hear. So if you're a Black man, all the information I'm going to share with you is going to be geared towards you specifically.
Yes.
Um, but it took some time. It really took some time to get
Yeah.
there. It was just trial and error. Like, we'll figure it out. And I think now we're at the point where people are starting to be more receiving, and now we're starting to offer um, you know, uh, programs for people in the community. So if we're
Yeah.
talking about diabetes, this month we're giving away, consultations with nutritionists. We're giving away 1 month of, free fitness, Zoom workouts. Or if it's, we're doing a scholarship for students to give, help them get into college if you're in a STEM program. We do a little bit of everything because
And
we want to not only give you that information, but we want to say that we've helped in some capacity. Like, we've opened the door for you in some capacity to do better.
right, because you can have all this knowledge, right? And we can share the knowledge, but if you're not doing anything with that
Right.
knowledge, you don't become wise about it.
Right.
And then if you're not wise about it, how do you even understand what's happening?
Exactly. And
So,
sometimes we just need a little push. And that's why I started doing the programs. And I'm thankful for the people who have sponsored or who have offered their services because, like, last month we did a little bit of mental health. We did all month long mental health.
yeah,
And there were some
yeah,
people
we did
like,
month.
yeah, there were some people who were saying, okay, like, are you going to be giving anything away? And I said, all right, I got you. Don't worry. And we gave away 4 sessions, free sessions with a licensed therapist because there were so many. And this was just like a step in the door because a lot of people are going to say, I can't afford it. I can't do it.
Right,
Or maybe I don't feel comfortable enough to like go to a therapist, but here I am saying no, do it, and I'm giving you the opportunity to try it out for free,
right.
so it's like, all right, now I have somebody kind of holding my hand, walking me through this process. I'll do it. And 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 it makes a world of a difference.
Yeah,
Like, when someone is saying, all right, I've got your hand, let's do it together, it
mm,
makes a world of difference. So
yeah,
that's kind of where we are right now.
yeah. Because we know, like you said a few things. We know that a lot of the times why people don't have information about healthcare, it's access, but it's also that lingering mistrust of
Yeah.
healthcare
Yes.
within melanin-rich communities, specifically Black and African American
Hmm.
American men. So, like, a lot of the times, we've talked before, like, they don't go to the hospital, they don't get things checked up. They're not proactive. It's
Right.
more reactive.
Right.
So, how do we get to this space where we're proactive about
Right.
health? And the only way to do that is through information, knowledge, knowledge, wisdom, and understanding about what's happening
That
with
is
us
true.
and with like our communities.
Yeah.
So, I think that's a good thing. And this is why it's important. Like, even like what you said about like the scholarships, it's important because all of those things are interconnected.
Mm-hmm.
People who maybe cannot afford to go to school, but maybe the scholarship money is just that little bit that they need
Yeah.
to move in, right? Because when we think about underserved communities, what are the connecting factors? It's the socioeconomic status, and a lot of
Yes.
the times it's low. So it's like low income, bad food, low education, because for different reasons, and all of those things are interconnected. So we have to address a lot of things in
Yeah.
order to see like meaningful change and outcome.
Of course. And that, I guess that's why I'm so passionate about public health. Because it allows me to just have a hand in that whole process of just doing something for someone who
Yeah,
deserves it, who needs it.
who needs it?
And it's specifically with Let's Talk Health. There are so many people who reach out, and they're afraid of maybe making a comment under a post, so they'll DM and they'll
Mhm.
say, okay, well, are you going to be doing this? Are you going to be doing that? And it's like, oh, I wasn't thinking about that, but thank you. Yes. And I'll definitely keep you in mind, because people are seeing it and they know that this is something that they need to focus on within themselves, or this is something that
Yeah,
they need to look into within themselves. And so if
yeah.
someone's talking about it, maybe they'll offer something free, and then maybe that'll be my way, to get something done, maybe to see a free doctor here or to do this.
Hmm.
Listen, I don't care what your motive or what the storyline is behind it, but the fact that you're reaching out and wanting
Yeah.
help and wanting me to do this, I'm going to do it. I'm going to do it, plain and simple.
Yeah, it's good. Take the step. So if we're
Yeah,
encouraging people to
yeah.
take the step, that's good enough for me.
That's that's
You know.
all I want. I want everybody to
Um,
live their best healthy lives. Like, come
mhm.
on, what we got to do?
We only have a few questions left, but I do like to take questions from the chat, and we
Yeah.
have a question from Sovereign Needs of Peace, Kashia and Aquia. And for those of you on Facebook, if I can't see who's on Facebook, but I don't think there are any comments. I have like all the gadgets, like to see everything. But definitely feel free to comment or ask a question. I think it should come through on this other medium.
Yeah.
But Sovereignty says, thank you for sharing a bit of your process for reaching your ideal audience. Why are men of color less likely to go for screenings and checkups? But then she says, oh, there you go. You addressed my question. So I think through the
Okay.
conversation, we
Well, we could dig a little deeper into that.
okay.
Let's okay, let's be real. We all know that the conversation has been, for Black men, for Black women, you are strong, you've got this. If you show any signs of weakness, it's like taboo against your color, your skin, your race, whatever. We're supposed to be strong. We're supposed to weather through all storms, no matter what it is. And that's what's drilled into our brains. When a man is thinking, a woman, we could say a Black woman, let's speak for ourselves, but it relates to men as well. When we're thinking, oh, I've got severe cramps, I can't go to work. In our minds, we're like, well, we can't call out because we got cramps. Nah, we gotta get up, we gotta go, we gotta make it through this, we gotta weather through this. Like, there's no stopping us. We could be dying, it could be endometriosis, we could be out for the count. But what's in our head is we can't go to the doctor. We can't take time off from work. We
Hmm.
can't do any of those things. We got to be strong because we've got to take care of a family. We've got to do this. We've got goals that we're working on. It requires no days off.
Yeah.
And when you do that, what happens is you just don't realize how important following up with the healthcare provider is. And
Yeah.
nowadays, if you're a healthy male or a healthy female, you don't even need to go every year. So it's not even a burden for you. There are doctors that say, come back in 2 years, come back in 3 years. As long as your regimen remains the same, nothing changes in your health. You don't need to follow up every year. Now, if you have comorbidities, if you have other health issues, now
Mhm.
you may need to follow up often. And if you've never gone once, how do you know you've got those things? You don't know until you end up in the emergency room, because now you're really dying of like whatever it is that's going on. And so we wait, because the thing is, in our minds, we've got to be strong. We've got to weather through this. Like, I'm a strong Black man. I can't let them see me weak. I can't let them see me down. I've got to take care of my family. There's so much pressure put on us. And what does all that pressure do? Add stress, add anxiety, add, which makes us weaker, which makes us sicker. All of that factors into it. And so that's really the reason. And we just need to change that narrative. It needs to be, no, bae, no, king, you need to go get yourself checked out once a year, however often you need to. If you get referred to a specialist, you need to follow up with that specialist. If you need me to go with you, we need to have that support system. If you need me to go with you, I will go with you. And that's it.
Mm-hmm. We don't always have to show up for the outside world. So we have to show
Yeah,
up for ourselves
for
first.
ourselves. Yeah, yeah.
You know?
Get
Um,
that out of our minds. Like,
yeah, yeah. You reminded me. I have a story like about cramps. I remember like way back when I was younger. This was like still like working in the mall days,
yeah,
and I had cramps like so bad, and I was just like, I'm calling out, and it was kind of bad because I called out like right before I was supposed to be in, so I was already late. She's like, okay, you're getting written up. I was like, okay, fine. Like you have to have that attitude sometimes. Little did I know that was like probably like one of the best things I ever did. It was just like,
yeah.
all right, see
You
you
you know
tomorrow.
what? But I understand that there are a lot of people that can't do that.
Yeah.
There
Because
there
I was
are
living at home at the time.
Yeah, there are a lot of people who are living paycheck to paycheck, or they're
Yeah.
behind on paychecks, or whatever it is. They are not afforded that opportunity. So it really is a burden for them to have to take off from work. It is a burden for them. And we could always say, oh, maybe go on your day off, or, because now clinics are open from like 8 a.m. to 8 p.m. Go
Mhm.
on your day off, or do this, but what if they're working 2 or 3 jobs?
Right. Right.
Like, we
They
can't.
offer more fun.
Right. The one that's gonna write me up, because all of them are gonna write me up for
Right.
calling out.
Right.
But we have to also be mindful of that. And that's what really aids to the stress, and really aids to people, aid in people saying, I'm just not gonna take the time off. I'm just gonna, work through whatever it is I'm going through, because I can't do it. And that's where, like, health reform policy, all that stuff comes into play.
Hmm.
Because we need jobs to offer that safe space for their employees to be able to take time off should they need to for their health.
Right. Right. The same way that, you're allowed to take time off to vote or do
Right.
anything else, or they allow like time off to go get vaccinated or
Yep.
whatever it is, it should be like commonplace. Like I need
Mm-hmm.
off to go and handle this
Mm-hmm.
without being, reprimanded, chastised, or made
Yeah.
to like I'm, lower than dirt.
Yeah. And just show proof that you went. All right, I went to the
Right.
doctor. And that's it.
Yeah.
Like, that's really all it should be. But
Yeah.
we're not there yet. So
No.
that's why we still have this burden of, Black men, just feeling like
Hmm.
some Black men feeling like,
Yeah. And the truth is, like, for the most part, like, because we're talking to like, NPH students and people like that. So like most likely, like people like you and I, like we're going to have those jobs that offer that space and time to like self-care and take care of self. Some people work for Google and they have spas and whatnot in their,
right.
but everyone is not fortunate enough to have that type of job, that supports their lifestyle, livelihood, they don't have that. So
Right.
like it's so important, especially like as NPH students and people, if we're going to be advocating and helping other people to understand that, everybody has a different situation. So
Yes.
depending on whatever it is you're going to do, because it's public health. So at the end of whatever you're doing, there's always people
Yeah.
that they're the end user, they're the receiver of the
Right.
things that you're doing. So you always have to keep that in mind.
Yeah.
We
Yeah.
have a question in the chat or comment. Aquia is a nurse.
Okay.
It says like I once had a melanated male patient who wanted to leave the hospital because he needed to take care of his family after being treated. Trait is that trait? I think it's trait due to an allergic reaction. He didn't care about his respiratory issue. He didn't want to miss work. Is that trait or treated, Aquia? Just make sure I've read it properly.
Yeah.
There was a trach. This means he has a whole hole
He in his throat.
that's insane. You know,
He's hooked up
I
to
get
machines.
that
He
it's
can't
difficult.
breathe.
I get make that decision. That's
Yeah. Um, and you see that a lot. You will see that a lot, especially within the public health space. Or in the healthcare space, you will see that happening a lot. And I know if you do not come from that background, if you do not if you're not culturally aware, then you won't understand why people are making these types of decisions. Like, sir, you're dying. Why are you trying to leave the hospital? Taking care of their family, making sure that their responsibilities are met, that's first.
yep.
That's the first thing. And I'm pretty sure most of these people got a policy. So they're like, even if I die, my family's going to be taken care of. That's really where their mindset is. They're going to work themselves to the bone to make
Mhm.
sure that that responsibility is taken care of. And sometimes we as healthcare professionals have to
Yeah.
understand that we're going to encounter people like that, and we have to understand. And then we also have to provide them options. So if you walk out of here AMA against medical advice,
Right.
I'm going to need you to follow up with so and so and so within the next few days. And that's
Right.
usually what's written in the discharge notes. Okay, he left AMA, or, at least we'll document that we told the patient to do X, Y, and Z, follow up with the PCP. Here's a list of PCPs,
Right.
go, and it's up to you to do so. But at least we try our best to say, okay, here's what you need to do. Here are your next steps, and do that.
Yeah, the PCP is a big deal because a lot of people don't have PCP.
No.
And like here's the thing, like, a lot of people will be like, well, I think the body can heal itself. And I think that too. I'm, a big supporter of, learning about naturopathic and homeopathic medicine, because there are things people have been getting sick for years before we
Yes.
started making synthetic
Yes.
and things like that. But we know that man-made and synthetic medicines have definitely helped people, so we
Of
don't
course.
discount those things. But a lot of the times, like, so if you're going to move in that space where you want to be natural, you have to educate yourself, right? You can't
Exactly.
just be like, well, I do this, but you don't really know about it. So like,
Exactly.
sometimes you may, like you mentioned before, you need someone to hold your hand. So maybe if however you get there, start out with a primary care and see if they can refer you to someone.
Mm-hmm.
But you have to be educated on it.
Yeah.
Even if you're going to be moving around in the traditional medical system, like, educate yourself and
Yeah.
determine. That is the first step of advocacy, is the self advocacy.
One part of my research, I did like a comprehensive education program for the women that were a part of the study. And one of the most important things I shared with them, and I've gotten some feedback that it does help, is that if you're going to a doctor and let's say you're going to your primary care doctor for the very first time, which if you haven't gone for the year, I suggest everyone to make that appointment and go. Doctors are flexible. They have longer hours. There's no excuse. But one thing I did tell them is to write down every single thing that is bothering you and be specific. There
Right.
are times that our doctor is just not culturally aware, so they may not know. Sometimes Black people aren't great at explaining their symptoms. So they'll say, my chest hurts, when it's really a back issue. Or they'll, so be very specific. When I breathe, this happens. When I look this way, this side of my eye hurts. Like, be very specific, even
Yeah.
down to the time of the day. Be very specific. Write everything down,
Hmm.
and also write down questions. If a doctor says something to you, that is not the end all be all. You are allowed to get a second opinion.
That's
You
right.
are allowed to do your research. And I've had patients that come into the hospital, they already researched everything that's going on with them. And they say, okay, doctor, so I looked up at this study done in 2019 and they said X, Y, and Z. What are your thoughts on that? It is okay to do that. It is
Hmm.
okay to ask as many questions as you can. Write every single thing down. If you need to record, ask the doctor, is it okay if I record what you say? Because I'm not good with memorizing this. This is all new to me. I need to understand what's being said so I can, translate it to someone else. It is okay to do these
Yeah.
things. It is okay. And this is a part of advocacy. I want people to know that you come prepared with your list, you ask your questions, and that is the only way you are going to receive the quality care that you deserve because you know what's happening to you. And at that point, that doctor can say, from this list of things, this
Mhm.
is what we're going to do. And you get all of the care, all of the treatment that you need to get.
Right. That's a really good idea. Really good point. Make a
Yeah.
list.
Make
Be
a list.
make a list and be specific.
Peace.
So give us a pro about which I think you kind of have. So I'll
Yeah.
just say based on what we've discussed today, like whether it be like the doctor of public health or working for a for-profit hospital, give us a pro and something that you wish you could change.
Okay. So one pro I would say about working for a for-profit hospital is that this is a pro and a con, actually.
That's fine.
It's a pro and a con. You learn how to navigate your way through the health system because it is so financially based.
Hmm.
So you understand the workings of a hospital
Yeah.
and what they're looking for, what their goals are, and what they're trying to do, and what that means for you as a patient. So
Hmm.
now, if I'm going to a hospital that is a for profit, I already understand the mentality. They're working on RVUs, which means they're going to be doing this and they're going to be doing that. And the goal is to make money. So they're going to try to, you know, get the money out of me.
Hmm.
That's a pro, but it's also a con because, and one thing I would like to change, because it takes away from the purpose of medicine. You've got doctors that are working, they're told their contracts are based upon how much money they bring in. So it's just going to be like 40 something patients in,
Hmm. You
long, really
did.
long. You question if quality care is provided.
Hmm.
And as a someone who cares about the quality of care that people are receiving,
Right.
that is one thing I would like to change. I would like there to be more of an emphasis on curating or creating a space that solely focuses on treating the patient and not the money,
Yeah.
and really not the money. And I think that that's for like every like healthcare space,
Yeah.
big pharma, everyone's in anyone in medicine is included in this. It shouldn't be about the money. It should be about making people healthier.
Mhm.
um
Absolutely.
and that's really the con with healthcare. I don't think any healthcare entity is for patients,
That's
for the
for
people. Huh?
and that's unfortunate.
It really is,
Mm.
and we have to be honest about that. Especially as a healthcare leader, I have to be honest about the system. I'm not going to lie and say, yes, there are some providers. Don't get me wrong, there are
Yeah.
some providers you can
Uh-huh.
definitely trust. I have one. I love her. Shout out to Jean. I love her because I know she will call me morning, noon, and night. How are you feeling? What is going on? There are providers like that. But the healthcare system itself is not built like that. And you will
Right.
have to dig before you find a
Right.
provider that's rare in a
Yeah.
sense. Um, but what that means is that we have to advocate for ourselves.
Mm-hmm.
We
Yeah.
have to advocate because the system is just not set up for us. And
Mm.
us, I mean everyone who participates or needs health services, it's not.
Right.
For melanated people, it's even worse.
Yeah.
But but we have to advocate for ourselves, and that's the takeaway.
Yeah.
I want people to know.
Yeah. And in order to do that, you need, to have education and information, like,
Yeah.
that you can understand.
Yeah.
So that's why we have the platforms that we built, to share that with people. So make sure
Yeah.
you come back and look at
Yeah.
information with Deidre. Visit Let's Talk Health Inc.
Yeah.
.com, and then go to True Health Live,
Yeah.
listen to the podcast, listen to We Gotta Talk, and so
Mhm.
the spaces where we're talking about the things that affect people, melanated people specifically. And there's also things about the larger public. Like I talk about a lot of stuff,
Yes.
So it's like this is where you can get it in a manageable way
Right.
because like we in for people who have had like certain career paths and they're at a certain level, there's a lot that we
Yeah.
so we're
Listen, like
share it. I'm like
I understand, especially from COVID, I understand that the media is just spewing a lot of information. And by the time we get it, it's just too much. It's overwhelming. We don't know what it means for us. And that's why I love spaces like the ones we've created, because we're just giving you we've done all the vetting we needed to, and we're just giving you what you need. Like we've done the work for you. And we're saying, this is what you need to do. We've done it all. We've looked at the data. We've done this. We've done that. And we're just giving you what you need to hear. And so I urge people to just view our platforms, look at the stuff that we're disseminating, because as public health leaders, we've done the research, we know what's out there, and we just want you to have the information that you need at this time.
right.
So it's not so overwhelming. It's not a lot to swallow. You can digest it, you can understand it. And that's why we're here.
Yeah. And that goes for people who are just starting out in their careers, even
Yeah.
in that. Like, here, let me show you about this shortcut. Like, and maybe
Yeah.
it can be a shortcut, but it's like, I'll show you what the traps are. Don't that one right
And
there.
I mean, you have the both of us who have navigated the waters for years now. I mean, reach out to us. Like, even if it's just a DM, a message, or what, reach out to us. Deidre can tell you, like, slide in my DM, I'm gonna answer. Like,
I was like,
hey, what you want to know?
hi.
Yeah, boo. Call me. Here's my number. Call me. Let's talk. Because we understand what it's like to go through this process. We understand how difficult it is, and we want to help. Like, we didn't go into public health for no reason. Like, we want to help. So, reach out to us. Use us as, a source, a reference, something. Like, that's what we're here for.
Yeah. Before our last question, I'll just head over to the chat. Aquia says, I agree. There are certain medications or treatments we must document or do having all to do with money. Makes me angry. And I'm so happy to hear you as upper management speak on this.
Yeah.
Oh,
Yeah. I keep it real, girl. I'll tell you like it is. Like,
yeah, there's a lot of stuff. It's like, it's like a curtain behind me. It's like, there's a lot of stuff that gets
I tell it to you like it is. I mean, it is what it is.
No glowing head over here.
No.
Tell you with all the gadgets, and it's like this is what's happening.
This is what's happening. I mean, we all know it. It's just someone has to say it. We all know it. Like,
right.
It's nothing new. I just said it. It's
and you're exactly. It's the messenger.
Yeah.
The messenger. It depends on the messenger, and so if someone from upper management, executive staff is saying, listen, this is what it is. This is how it has been. These are the things that we can do to change.
Right.
Listen, because like we've had some experience.
Right.
So
yes.
sorry.
Go ahead.
So final question, what advice would you have for an aspiring public health students who are interested in like maybe a career path similar to yours, or working for a for-profit hospital, or nonprofit or community health center, or a teaching hospital, which I actually like. I'm partial to teaching hospitals because they do everything.
They're
so
good.
Like, you go in there, it's like chances are somebody knows how to fix
You're good. They're good. Shout out to Columbia, because I worked at Columbia in New York City. So shout out to my peeps at Columbia. That was probably the best teaching hospital. All right. Shout out to y'all. But there's only one thing. If you're trying to enter into the public health space, you need passion. Because there's a lot that you're going to see, a lot you're going to hear, a lot that you will have to withstand in order to survive. And if you're not passionate about it, if you don't have a care in the world for helping people, this is not for you. Your passion will take you along your journey. Your passion will get you into the doors that you need to get into. Education will assist, networking will assist, of course. But that passion and drive is what gets you up out of the bed when you know you've got 20,000 meetings, you've got angry doctors, you've got staff that you just want to get rid of, but you will walk in that door and you will say, team, let's do it.
Mm-hmm.
Passion is what will get you where you need to be. And if you are not passionate about public health, don't do it. There's so many other things you could do other things. But if this is where you need to be, you have to have passion.
Yeah. Excellent. I
Yeah,
don't have anything else to say after that. Like,
that's
definitely.
it.
Especially when you're
That's it.
dealing with people and personalities, and you have to like what you do. You have
Yes, yes,
to.
yes.
Yeah.
That's it.
All right. So, greetings, Maxine. Thank you for joining us. We are done. Thank you for all of those who joined us on Facebook. I didn't see any comments, but if there were, please forgive me. I will make sure to check out your comments afterwards and answer anything that
Yep.
I can. I will be putting Dr. Nichols' information in the description box below. This is
Yeah.
on YouTube, so the video will live on YouTube. Um, and so if you have questions for her, you can reach out. As always, for me, if you're interested in having your career spotlighted on the show, please feel free to DM me on Instagram, Facebook, whatever, or you can email me at deidresully@gmail.com. And or if there's like something that you would like to hear, like a specific position or career, I'll do my best to find that person and we'll get them on the show. So thank you so much for joining us. Thank you, Dr. Kadesha Nichols, for joining us. I'm
You're
so happy.
welcome.
And Dr. Nichols is going to be on the True Health Live podcast coming soon. So stay tuned for some of that information.
Yes.
Thank you so much, everyone.
Thank you for having me.
Oh, thank you for joining. So we will see you guys next week. As always,
Yes.
forward. Peace.
Bye.